Back again with Dr. Michael Misalek, our good pathologist. You mentioned breast cancer and prostate cancer, and it's interesting because tell us about the statistics and the disease, these two diseases, and how similar or different they are.
Right. Well, I have to honor you at the gala the other night. You asked the crowd what was the color of breast cancer awareness, and immediately everybody knew pink. When you asked about prostate cancer, not so many.
That's right.
And the same thing about when is Breast Cancer Awareness Month versus Prostate Cancer Awareness Month. I would venture to say that most listeners out there don't know how similar prostate cancer is to breast cancer. Breast cancer accounts for about 230,000 new diagnoses each year, and prostate cancer right on the same number exactly. It's estimated that 1 in 8 women will develop breast cancer, and surprisingly, 1 in 7 men will develop prostate cancer, so actually a little bit higher. Both are the number one cancers in each of the sexes. Both account for about 14% of new cancer diagnoses. And
so it's fascinating because I bet you a lot of people don't know how close these two diseases are, how parallel they are. The number of deaths are almost the same, 27,000 versus 30,000. And, you know, the only difference is that women are diagnosed around like 61 and men are around like 66, that 5-year difference that we know. But that's amazing what you're saying about the number of these kind of...
Right. And even under the microscope, we find a lot of similarities, as in breast cancer, where there's a spectrum of changes from benign to malignant, and we have many of these uncertain gray zone diagnoses in the middle. So too with prostate cancer, which is another reason why, as a patient, you need to get a hold of your pathology report and understand those diagnoses.
And we're seeing now even the same genetic components that are similar. We're seeing BRCA1 and BRCA2 in men with prostate cancer.
Absolutely.
And I just wrote an article about, possibility that one day, if you really have good genetic component, when you know a man is headed toward a very aggressive prostate cancer, just like the same kind of genetic component that Angelina Jolie has, do we do one day a preemptive radical prostatectomy to save someone's life? We're not quite there yet, but maybe in the future we will get there.